Hi guys, in this episode we'll be looking at the birth control Yaz, and I'll also give you a few pointers if you're running into some troubles with it. Okay, so let's jump right in. The first most common headache by far in users of Yaz was headache. And that was noticed in 4.8% of users. The next most common side effect noted was spotting, which is bleeding in between the regular expected period. And that was noticed in 4.5% of users. Next up was breast pain, and that was noticed in 4.3% of users. And again, you would expect that because it's a hormone, so it mimics some of the same side effects that your own hormone production could cause. Number 4 was loss of period or irregular periods or no period at all. That was noticed in 2.5% of users. Now, while some females might find that benefit, all of a sudden you don't have to contend with periods, it also can be disconcerting because one of the advantages of having a period each month is that then you have an alarm clock that says, hey, I'm not pregnant. So if your period is absent, suddenly you don't know if you're pregnant or not. So that can sometimes be a problem. Number 5 was nausea. But that wasn't particularly common. That was only in 2 out of every 100 users, or 2%. Next up was mood changes. So feeling irritable, feeling cranky, feeling depressed. But it's not, again, not very common. Only 1.1% of users experience that. And surprisingly, number 7 was acne, which is unusual because most birth control pills actually help to reduce acne by reducing androgens, which then secondarily reduce the amount of sebum that the skin produces to make pimples. So that was a little surprising, but it's also not very common. Only 1 in 100 users notice that. And who knows, it's quite possible it had nothing to do with the Yaz at all. And then, while not a common side effect, people are always asking with all these drugs about weight gain. So weight gain was noticed in less than 1% of users. So overall, if you look across the entire spectrum here, you can see it's a fairly well tolerated birth control pill. Now, for the spotting and irregularity issues, I usually tell my clients to wait 3 months or 3 cycles before giving up on Yaz, because very often, if you'll persist with it, those irregularities or menstrual difficulties will disappear. For all of these, if you have been experiencing these kind of problems and it's not settling, then you need to consider what a birth control pill actually is comprised of. So every birth control pill on the market, doesn't matter what the brand is, always has a combination, a proprietary blend of estrogen and progesterone. There's different synthetic versions of estrogen and there's different synthetic versions of progesterone. But generally what you're getting when you change brands is the manufacturer rejigs these 2 hormones. So either maybe they reduce the estrogen, or maybe you're feeling moody so they increase the progesterone, or you were spotting a lot so they reduce it. Or you were spotting a lot so they increase the estrogen to retain the lining. So if you're having persistent problems with Yaz, remember there's a whole pantheon of other birth control pills with different variations of these hormones that your prescriber can choose from. So you're not stuck with Yaz, there's a bunch of others that you can choose from. So if you're not happy, we're not happy. Thank you for watching, and you're welcome.